All right, let's jump right into this explainer. Today, we're looking at a truly rare turnkey specialty acquisition. We're talking about an opportunity that offers absolutely staggering owner economics located in a highly desirable, fast-growing region in the Western U.S. So ask yourself, what does the perfect medical acquisition actually look like? Well, for time-poor healthcare buyers, allergists, immunologists, or strategic investors, it's got to combine a bulletproof foundation with massive untapped growth potential. And honestly, that's exactly what we have on the table here. Just to set the baseline, in 2025, this 50-year established allergy and immunology specialty practice generated over $865,000 in sellers' discretionary earnings. Half a century of goodwill gives it a stellar regional reputation in a high-demand, but severely supply-constrained specialty market. But here's where it gets genuinely remarkable. The lifestyle math is just off the charts. The current physician owner achieves that high-margin revenue working just 2 clinical days a week. That's roughly 16 hours. Literally a 2-day work week. The contrast here is brilliant. This part-time operation vastly outpaces the typical compensation you'd see for a full-time employed specialist. It absolutely proves the practice runs smoothly and highly profitably without needing a full-time physician on site. It's the definition of a true turnkey transition. And the financial trend over the last 5 years tells a really compelling story. Thanks to highly efficient operations, outsourced administration, and a fiercely loyal, long-tenured team, this practice hasn't just stabilized its revenue, it's expanded its profit margin to a massive 44.9%. To put that in perspective, most practices this size operate at less than half that margin. So what's the secret engine behind these reliable numbers? It's sticky, recurring revenue. The clinic administers around 20,000 immunotherapy injections every single year. That boils down to about 100 injections a day, creating exceptional patient retention that's built on solid 3 to 5 year treatment plans. Plus, that recurring clinical volume is protected by a remarkably stable payer mix. It's heavily weighted toward premium commercial insurance, sitting at roughly 66%, with Medicare making up another 26%. Very favorable numbers there. All of this is supported by an incredibly warm and loyal clinical team, with a head medical assistant of over 30 years, a clerical leader of over 20 years, and dedicated APRN support. The practice effortlessly handles roughly 24,500 annual patient encounters and brings in about 100 new patients every single month. It's a well-oiled machine. Now here is the absolute most crucial point. Existing patient demand is the primary constraint here, not patient acquisition. A new owner could unlock massive growth simply by stepping into a full-time schedule or by utilizing this spacious 4,000 square foot clinic to add a second provider. The opportunities are literally endless. You could expand to evenings and weekends, open a satellite clinic for patients who are currently driving hours just for care, reactivate local referral outreach, or implement a modern EMR system to digitize their paper records. The growth levers are already built right in, waiting to be pulled. It really begs the question, if a part-time owner can achieve these margins in just 16 hours a week, what could a full-time visionary build here? Interested in learning more? Scan the QR code to explore this confidential acquisition opportunity with strategic medical brokers.